Beyond the fire's dangers, the air quality in and around the fire zone is being considered a new and deadly source of pollution. To talk more about that part of the story, Dr. Mena Mirhom is an assistant professor at the Columbia University Medical Center. Good morning, doctor. Great to have you.
Good morning. Thank you for having me.
Yes, so many health experts calling pollution a silent killer. The wildfire smoke is said to contain a mix of hazardous air pollutants like nitrogen dioxide, ozone issues, and other lead and chemicals in the air from these massive wildfires. What's the solution? You know, we all need air. We can't live without it. But the conditions in California are getting worse and worse. So what can people do to try to drink healthy water and breathe fresh air?
You're absolutely right. The risk here is very high, especially for those with any pre-existing conditions like asthma or lung disease. So one acronym that I walk my patients through is AIR, actually. A stands for avoiding extensive outdoor activities. And if you will be outdoors for a while, it's important to be able to wear a mask during this difficult time. And then through that, one important thing is to be able to improve indoor air. So we're using a HEPA filter, the kind of filters that would regularly cycle the air and make sure that it is more safe to be able to consume. And then R is to regularly check the air quality index. This is an important area because right now the air quality can contain up to 70 times more pollutants than usual, and smoking or drinking, or rather inhaling a lot of this air can be an equivalent to smoking several packs of cigarettes. So we want to be very careful, and that's why I walk patients through this simple acronym to maintain some tips for safety.
Well, research reportedly showing any progress made cleaning up pollution from things like tailpipes and smokestacks is essentially being wiped out by the wildfire smoke. Talk to us about that research as well as some of the longer term effects, unfortunately, many of these people in California may experience.
Yeah, this is the unfortunate thing that we have to bear in mind, is that there are both short-term effects like difficulty breathing, blurry vision, coughing, and things of that nature, as well as very important long-term effects. And that's why in the aftermath of these wildfires, it'll be really important, the same way that we saw after catastrophes like 9/11, to be able to get checks regularly, because there is a lasting impact that can happen on the lungs that we're able to get ahead of a bit if we have some preventative measures, some imaging, some screening, and that can put us into a position to prevent long-term complications like cancer, which can sometimes develop from these kind of disasters.
So true. And many of these individuals, when it's safe, they will return to the ashes of their home to try to gather some valuables and other things that they want to make sure that possibly survived the fires. But they should also be concerned in terms of their health. Now, you just mentioned in terms of covering their face, in terms of with a mask, to reduce the amount of pollutants that they intake. But do you recommend that they actually periodically go get a health checkup?
I do, and what you're mentioning there as well in terms of going back to the scene of the loss, there'll be two areas of health that we really want to emphasize that I talk to patients about. One is the physical health of not being able to be exposed, because you don't know in the aftermath of a fire what pollutants are there, so you want to still treat that as an area that can be harmful. And then secondly, there is the emotional component or psychological component of grief. Now, dealing with this kind of massive loss is another important area after a catastrophe that we want to be ahead of, to be able to lean on friends, faith, and family, because this is a very vulnerable time as well as we're dealing with these mass kind of losses.
True, because that emotional heaviness also weighs on your immune system.
Very much, yeah. That's a key factor. That emotional impact on your immune system has been well documented.
Well, speaking of your immune system, of course, we want people to check in with their primary doctor, but are there any supplements or ways that people can try to stay safe in the meantime, maybe taking extra vitamin C to support the immune system and other sorts of issues that they may face?
Yeah, absolutely. Some of the most important things I would say for immune health at the moment would be vitamin C is a good start. Omega-3 fatty acids are also a good supplement to have. Some vitamin D supplementation could also be good, given the fact that there is also now not a lot of sun exposure. Those, along with actually the number one place where you can get great immune support is just from a healthy diet. Green leafy vegetables is a good place to start. Fish oils, those are also good places. So nutritional support is the number one place where you can support your immune system. In addition to, as we were mentioning, as much as we can, decreasing the stress level, which is difficult given what's happening around, but to be able to manage that and have good nutritional support and supplements, those three components can really help our immune system.
You just mentioned in terms of support, and emotional support is very important, as well as physical support through supplements and vitamins. Can you talk to our viewers and mention certain strategies in terms of to deal with that emotional support? Many people find it easy to talk to family, but sometimes people feel that grief weighs so heavy that they don't want to really share what they're feeling. Some people feel embarrassed, even though it's understandable that it's not their fault, that these are external conditions, but some people hold these things inside. So what are some strategies in terms of the deal with that emotional need and emotional support?
Yeah, absolutely. That's a great question because grief can feel very isolating. And one thing that we walk patients through is that in this moment, we're sort of all in it together. So as we're struggling with what's the best way for me to communicate, first to know that I'm not alone in this. Anyone I speak to, and we're seeing this kind of solidarity around the country, whether you're in California or anywhere else in the world or in New York like we are, you know that you're going to have support. So the first thing is to be able to know you're not alone, and whatever way that you're comfortable, whether it's through a text message or a phone call, and whatever capacity or relationship that you have. Maybe that is a close friend, maybe that's someone in a faith community, maybe that's someone in a sports team. Wherever is the atmosphere that you feel like you're able to express. And on the receiving end, what's really key there as well is we want to make sure that folks have the space to be able to share what's on their mind, and we want to listen a lot and speak a little. The way to support someone in this moment is to be present, less so about knowing what the right word is to say. But in that grief, there's also gratitude that we can have. In that guilt that we can have as why am I the one surviving, there is also gratitude, and there is also purpose that we can find in that as well. So, and as we walk folks through that, we can find sort of beauty in tragedy, which can be difficult, but is possible.
Well said, Doctor.
Dr. Mena Mirhom, thank you so much for your great insights. Appreciate it.
Thank you. Thank you for having me.
Coming up, firefighters still fighting the flames in California.
Strong winds returning. We're talking